Bird's flu. What is bird flu? Bird flu, also called avian influenza, is a viral infection that can infect not only birds but also humans and other animals. Most forms of the virus are restricted to birds. H5N1 is the most common form of bird flu. It's deadly to birds and can easily affect humans and other animals that come in contact with a carrier. Epidemiology. H5N1 was first discovered in humans in 1997 and has killed nearly 60% trusted source of those infected. Currently, the virus isn't known to spread via human-to-human contact. Still, some experts worry that H5N1 may pose a risk of becoming a pandemic threat to humans. Etiology. Although there are several types of bird flu, H5N1 was the first avian influenza virus to infect humans. The outbreak was linked to handling infected poultry. H5N1 occurs naturally in wild waterfowl, but it can spread easily to domestic poultry. The disease is transmitted to humans through contact with infected bird feces, nasal secretions, or secretions from the mouth or eyes. Pathophysiology. Hemagglutinin and neuraminidase are critical for virulence, antibodies of acquired immunity to influenza. Hemagglutinin type 5 attaches well to avian respiratory epithelial cells, allowing cellular infection. Neuraminidase cleaves the bond that holds newly replicated virions to the cell surface, permitting the infection to spread. Symptoms. You may have an H5N1 infection if you experience typical flu-like symptoms such as 1. Cough 2. Diarrhea 3. Respiratory difficulties 4. Fever over 100.4 degrees Fahrenheit or 38 degrees Celsius 5. Headache 6. Muscle ache 7. Malaise 8. Runny nose 9. Sore throat. Diagnosis. The test designed to identify avian influenza is called Influenza A H5 Asian lineage virus real-time RT-PCR primer and probe set. It can offer preliminary results in only 4 hours. However, the test isn't widely available. Physician may also perform the following tests to look for the presence of the virus that causes bird flu. 1. Auscultation, a test that detects abnormal breath sounds. 2. White blood cell differential. 3. Nasopharyngeal culture. 4. Chest X-ray. Additional tests can be done to assess the functioning of your heart, kidneys, and liver. Treatment. Different types of bird flu can cause different symptoms. As a result, treatments may vary. In most cases, treatment with antiviral medications such as oseltamivir, Tamiflu, or zanamivir, Relenza, can help reduce the severity of the disease. Patients should be placed in isolation to avoid spreading the virus to others. The doctor may place you on a breathing machine if you develop a severe infection. Prevention. One can minimize the risk by avoiding a. Open-air markets, b. Contact with infected birds, c. Undercooked poultry. Be sure to practice good hygiene and wash your hands regularly. The FDA has approved a vaccine designed to protect against the avian flu, but the vaccine isn't currently available to the public. Experts recommend that the vaccine be used. H5N1 is the most common form of bird flu. Must subscribe the channel for more videos. Thank you.